talking about the 90% jump in COVID cases in the last 24 hours in the country. Is this a cause of concern? That's the big question that we are asking right here on Mirror Now. So with an almost 90% jump, India has now recorded 2,183 new COVID cases in the last 24 hours. The active caseload currently stands at 11,542. And not just this, after 11 weeks of a steady decline, COVID cases have seen a 35% spike in weekly numbers. Now, weekly positivity rate also has increased from 0.27% to 0.32%. Now, this primarily is due to the spike in cases that have been reported out of Delhi, Haryana, and the state of Uttar Pradesh. Delhi has been the city showing the highest COVID spike, recording 517 new COVID cases in the last 24 hours, with a COVID positivity rate that now stands at 4.21%. Now, do we have reasons to worry? To discuss more about all this, I'm now joined on the broadcast by an expert panel. Dr. Ishwar Gilada, who is an infectious disease expert, joins me on the broadcast. Also joining me is Dr. Mohan Gupte, ICMR epidemiology, and also Dr. Sanjeev Bagai from the Nephron Clinics joins me. Dr. Bagai, I'll start with you first. 90% increase is what we are seeing. Do we have reasons to worry, and what is the explanation to this particular spike that we are looking at?
Good afternoon. I don't think there is any cause of worry or panic, but there is a cause of extreme caution and to be proactive. So let me put it in two parts. Why is this virus behaving a little differently than what the earlier Omicron or initially the Delta variant presented as? So what we are now seeing is a combination and sublineages of the Omicron. As we know that Omicron contains almost 90 mutations, 40 more than Delta, and almost 37 in the spike protein in the receptor binding domain, which is the main area where the virus attaches onto. This is on the way in the recombination between B1 and BA.2, what we call as XE variant. It has picked up the bad mutations of various others mutations which were actually present even in the Delta. Without going into the details like LR452 and F486V. Now these are in what we call as loop mutations, which make this highly contagious. So this is 10 times more contagious than BA.1 and 40 times more contagious than BA.2. Yes, the Omicron is milder than Delta. The worldwide 7 studies have shown this, but mild is very relative. So for people who are not fully vaccinated or vulnerable or with comorbidities, this mild can turn out to be a severe infection.
Getting back to the important discussion that we've been having right here on the broadcast, this is to do with the spike in the COVID cases after the 11-week lull. Now, we have to understand why are the cases suddenly rising, and to actually discuss more about this, I have an expert panel who is with me. Let me reintroduce my guest. Dr. Ishwar Gilada, who is an infectious disease expert, is with me on the broadcast. Also joining me is Dr. Mohan Gupte of the ICMR, and Dr. Sanjeev Bagai is with me. Dr. Bagai, you were making that point there before I had to cut you out because of that press conference. Please go ahead and make it.
Yeah, so just to take off where I left off is that the Omicron now is coming in recombinations. There is BA.1 up to BA.5, and there are 14 sublineages. Each one is behaving differently because it's a recombination. It's picking up the bad mutations, which were even seen in Gamma and the Delta variant. It's showing more vaccine escape. It's showing more immune escape, and it's definitely infecting the younger lot. There is a recent study which has been published in British Medical Journal in which it has shown that this is affecting the younger children more and increased death rate up to 20% in children. Also, there is a study in Lancet which has come out last week from Geneva, in which has shown that schools are being confirmed to be the major hub of transmission. Now, all the children are not fully vaccinated. The children below 12 are still carrying the same viral load as adults. They transmit as much as adults. They carry the same respiratory infectious load in the upper respiratory tract. They play in hubs, in close quarters, and a lot of them may not be masking even in school. The masking protocols have been relaxed at the present moment. So there's a variety of reasons why the cases are increasing. I think we need to be extremely cautious. My advice as a summary, 3 points is that masking should still be promoted as being essential. I think it's your main weapon to prevent ingress of infection and outgress, that means to transmit the infection to others. Point number 2 is you must get yourself fully vaccinated, and the ones who are eligible for the third vaccine as a booster, it is extremely important. We know that the vaccine efficacy in Omicron has dipped as low as 21% with 2 vaccines, and with the third it comes out to 63. So the third vaccine as a booster is extremely important. And point number 4, the fight is still not over. It's easy to avoid crowded areas, poorly ventilated areas, parties and socializing. The fight is still not over. Back to you.
Right. Dr. Gilara, would you actually, make your point from there? Because very important points that Dr. Bagai has made. I would actually take into account the cases that have been reported in children. And we have seen this sudden spike, especially in the national capital and adjoining areas when it comes to the state of Haryana and Uttar Pradesh. The fact that there were so many cases that were reported in schools now that physical classes have started. And these are the age group which is still not fully vaccinated or vaccinated, so to speak, if we talk about the junior classes. Now, what is the option before us? Because this sudden spike, a 90% jump, is something that none of us were ready for.
Graha, thank you very much for having me on this show. Most important thing is we should not comment on based on only 1 day spike. We should talk about weekly change. Number 2, Omicron or any of the new variant, they are going to act on those which are vulnerable or eligible population to get infection. Currently, what we see nationally, 90% of us have one infection at least. So we have a natural immunity. 80% of us are doubly vaccinated. So around 85% is a hybrid immunity. But if you talk about at least one immunity, at least 95% of us have some immunity. So 5% population, it looks a 5% small, but 140 crore, 5% becomes 7 crore. And that population is more in the younger age group, which are children, which are not vaccinated. The problem in our country is that we have too many communities and too many people decide. There's a DCGI which has given license for vaccination. But the committee which is deciding vaccination, they have not yet decided for vaccination for 5+ children. So currently it is 12 to 15 and 15 to 18, that is approved. Lastly, a lot of people are not taking vaccine, or it is not so much enthusiasm because COVID cases are lying low. So actually speaking, vaccination is best done when the cases are lying low. When the cases are up and you are providing vaccine, you do not know whether you are vaccinating already infected person or incubating infection person. So in that sense, this is a better time. And we should not go by what number of cases are there. We should vaccinate as early as possible. In this, we have 2 different channels. One is the pediatric channel.
Okay.
We should start vaccinating them at the school only because the uptake is very low. If you have only 5 or 6 crore children to be vaccinated, it has already taken 1 month, and we have only 30% of them got 1 dose. I think this is pathetic. And secondly, the gap between 2 vaccine or second to third dose, which is 9 months, should be reduced to 6 months. And Government of India started a paid vaccination for 60 below people. I think that should be made both at both the places, at government as well as private, so that those who cannot afford, they can take in government places, and at least 45+ population is vaccinated with the third dose because they have been taken vaccine 6 or 9 months back. So if we look at this situation, I think we can overcome the problem. It is not a very serious problem at all.
Okay. And Dr. Gupte, the fact that, this 9-month period that we are looking at, do you think that is also dissuading a lot of people to go ahead and take that booster dose? Because a lot of them have thrown caution to the wind, considering that 11-day lull, that 11 weeks lull that we saw where the COVID cases really dropped and now people have begun to socialize. Do you think this is also impacting the sudden spike in cases that we are witnessing?
Yeah, I would agree with you completely. Because there is laxity in the community and people are not much worried about COVID-19 now. But apart from that, if you look at the numbers, you're saying 90% increase. I would agree with 90%. But the actual numbers, if you look at 1,150 has gone up to 2,183. Now, this is not a big jump in terms of numbers. If you talk in terms of percentages, you look at a very high rise. As my both panelists have been saying, repeatedly, we need to be careful. We need to look at all these cases. We need to look at weekly case rise and so on. Cases have been rising for the last few days, as we have seen in different areas in our country. But the number is not so high. And therefore, we need not be really concerned about what's going to happen in time to come, fourth wave and so on. But we need to be vigilant. We need to keep a close watch on what exactly is going to happen.
Dr. Bagai, the fact that all three of you are saying that it's not very concerning at the moment, but we saw how badly did the second wave affect all of us, and how how badly did it spiral out of control. We keep talking about the XE virus. We are seeing what is happening in Shanghai and other places where people are having to witness that intense lockdown due to the kind of cases that have been reported out of there. Do you think the lifting of curbs was too soon? The government in the state and center should have actually thought, twice before going ahead and lifting all those curbs that have now been put in place and probably been lifted, the relaxation that we've been talking about?
Three important points here. One is the strategy has to be modulated because the situation is continuously dynamic. So we need to give a graded response depending upon how the infection in the community is increasing or stabilizing. But at the present moment, I would very strongly suggest the Indian government that we should introduce masking, especially in public areas or in public transport, in restaurants and malls. Point number two, the gap between the second and the third dose should not be more than 6 months. There is sufficient data in the international publications to show that the immunity wanes to a almost undetectable level between the 5th and the 6th month after the second dose. And third, most importantly, is to promote the third vaccine across the board. Don't put restrictions of government and private. Let this vaccine be readily available like an influenza or a hepatitis B or a chickenpox vaccine is available in every private clinic. 75 to 80% of Indian healthcare is in the private sector. Allow it freely available without any restrictions. Make it as easy into the community right at your doorstep as possible. This is a golden opportunity we have in the next 2 months, 3 months before the summer ends, that we should reach a figure of 210 to 220 crores, so that we reach a peak level of community acquired immunity. We are about 187 crores now, which is fairly good. It's a monumental task. Hats off to the Indian government and the medical community to have achieved this. But we have that last mile still to be covered, and we want it covered as quickly as possible. Do not remove your mask. This is my message. Please wear your mask in outdoor activities. If you have symptoms, do not neglect it. You can have a home test as a rapid antigen test, but confirm it with the RT-PCR. Inform your local authorities. There is no stigma for this. It is mild if it is caught early. Prevent it from the children by vaccinating, and the pregnant ladies definitely need to be included in the vaccine schedule.
Very important points that all of you are making. Thank you so much for joining me on this very, very important discussion. Dr. Bagai, Dr. Gupte and Dr. Gilada. This is very important. Don't drop your mask like we have been mentioning right here on the broadcast, because this is not yet time to throw caution to the wind. Socialize, but please be safe. Maintain that distance and wear your mask, and of course, get your booster shot if you are eligible.